Let's talk about acupuncture for pain, headaches, and more. Hey everybody, I'm Dr. Jeff Williams with Creekstone Integrated Medical Clinic right here in Amarillo, Texas. As many of you know, we've offered acupuncture here for about 6 years now. Our acupuncturist, Erin Sessions, she's a fully licensed acupuncturist, and we've seen amazing results and satisfaction with her patients. In fact, the VA hospital here in Amarillo, the Thomas E. Creek VA Medical Center, they've been sending patients here for several years now to have acupuncture treatments with Erin, mostly because the research is really solid for acupuncture's effects with regard to stress, tension, PTSD, chronic pain, headaches, and migraines. The government, they wouldn't pay for it if the research wasn't there to show how well acupuncture can treat these things. It's been a real pleasure to watch these sometimes grizzled and grumpy veterans come in and they're questioning why they're here. And it's fun to see them smiling and joking and enjoying their visits only a couple of short weeks later. The effects of chiropractic and acupuncture combined really can turn the situation around very quickly. And when people feel better and they get more sleep, they tend to not be quite so grumpy. Now, some of our very favorite patients are veterans who were difficult in the first visit or two, and then they cleared up, and like I said, now they're just some of our very favorite patients, and that's just awesome. Now, currently, I'm the department chair for the scientific affairs for the Texas Chiropractic Association down in Austin, Texas, and I was recently asked to put together some research information for acupuncture, and I was happy to do so, and in the process, I wanted to share a couple of the more significant papers here with my Creekstone audience, here on my blog page, on Facebook, and on YouTube as well. Now, the first one is called Clinical Evidence for Association of Acupuncture and Acupressure with Improved Cancer Pain, a Systematic Review and Meta-Analysis. This is by He et al. And published in JAMA Oncology in December of 2019. So the first thing that jumps out about this paper here, especially for those new to reading through research or paying any attention to it, the really interesting thing about this is that this is a systematic review and meta-analysis. And that is at the very top of the research pyramid. For example, simple little case studies and animal studies, pilot studies, or things of that nature, well, they live and exist at the bottom of the pyramid, the less meaningful or the less impactful part of the pyramid. As you climb the pyramid to the more important stuff, you'll see cohort studies and randomized controlled trials. And then at the very tip top, the most meaningful studies are the systematic reviews topped off by the meta-analysis. So what I'm saying here is that this paper is good stuff. It's good information, and it appears in a very respected journal, which is the Journal of the American Medical Association's oncology branch. So it's high level from several different aspects. Now here's why they did it. The authors, they wanted to answer the question, is the use of acupuncture and acupressure associated with improved cancer pain management when you compare it to fake intervention or fake acupuncture? And so here's what they found. A significant association was found between real acupuncture when they compared it to fake acupuncture. So again, a significant association was found between real acupuncture and reduced pain. And acupuncture combined with analgesic therapy, that was associated with decreased analgesic use. However, the difference in people that were studied and all of that kind of lowered the level of the certainty of the evidence. Still, in the wrap-up, they say this study found a moderate level of evidence that acupuncture and/or acupressure was significantly associated with lower pain intensity in patients with cancer compared with fake treatment. And this suggests a potential for a combination of acupuncture and acupressure to help reduce opioid doses in patients with cancer. And we know how dangerous opioids are, and so it's just really good news for everybody. Now, acupuncture, this next one has to do with acupuncture for neck pain, and it's called Acupuncture for Neck Disorders, Review for the Cochrane Collaboration. This is by Trent et al., and it can be found in the Cochrane Library, and it was published in May of 2016, so it's about 5 years old. Now, this review summarizes the most current scientific evidence on the effectiveness of acupuncture for acute, subacute, and chronic neck pain. For mechanical neck pain, we found that acupuncture is beneficial at the immediate term follow-up when you compared it to the fake acupuncture for pain intensity. It was also effective for disability at short term and the follow-up, and was effective at the short term and follow-up with waitlist control for pain intensity and neck disability improvement. Now, the effect does not seem sustainable over the long term. So whether subsequent repeated sessions would have been successful, that wasn't examined by the investigators in this study. So certainly can't rule out if they had performed acupuncture in a series, would that have been more effective long term? They don't know that yet. Now, to wrap it up, moderate quality evidence also indicates that acupuncture is more effective than inactive treatment for relieving pain at the short-term follow-up. All right, for those not yet on the acupuncture train, take another look. The VA here locally, like I said, they're sending the veterans over here. And again, we're seeing these old grizzly vets absolutely love it. And yeah, that's anecdotal, of course it is, but I'm telling you, there's something to it, and research seems to finally be catching up to it. Now, patients ask me how it works all the time, and I have to be honest, I'm not sure. I'm not an acupuncturist. I have some very solid guesses, but it's a lot like a TV if you think about it. I can't tell you the exact way a programmed signal gets into my house and shows up on the screen when I turn the TV on. I have no idea. But I know how to use it, I know how to make it happen, and I can enjoy the results. Okay? Acupuncture is safe, and it's virtually painless. So don't be afraid of acupuncture. The needles are tiny compared to what we regularly think about needles being. And you literally do not even feel them for the most part. Acupuncture is one of the most effective ways to reduce stress and anxiety, treat PTSD, resolve chronic pain, and treat headaches and migraines. The American College of Physicians, they recommend a multimodal approach to treatment for pain. So when you combine acupuncture with our chiropractic care, our medical care, our exercise, or our massage services, well, let's just say that pain typically behaves fairly quickly under those circumstances. And again, I'm Dr. Jeff Williams with Creekstone, and we want to help you. We want to help your friends and your family. If pain is ruining your life, give us a shot. What do you have to lose? Besides your pain, of course. If you're from the Amarillo area or you're going to be passing through, call us at 806-355-3000 and let's get you on our schedule right now. If you don't feel like calling, that's cool. New patients can simply go to creekstonecare.com and click on the Schedule an Appointment button in the top right corner, and you can set it all up virtually online from our website. If you're watching on YouTube, subscribe, comment, and share. If you're on Facebook, like, comment, and share. That sort of activity on our posts, it helps us reach more people, and we'd appreciate it. Until next week, be safe, take care of yourself, and we'll see you then.